Factors that impact self-efficacy in pelvic floor muscle training. I have nothing to disclose. Pelvic floor muscle training is an effective first-line treatment and preventative strategy for pelvic floor disorders. This can include bladder or bowel dysfunction, pelvic organ prolapse, pelvic pain, and symptoms associated with pre- or postnatal and menopausal populations. Pelvic floor symptoms can also be present in those who have undergone surgery or treatment for pelvic cancers. Self-efficacy refers to a person's perception of their ability to perform a task. Increased self-efficacy has been shown to promote adherence to pelvic floor muscle training and is indicated as a requirement for sustained behavioural change. This quote appropriately reflects the role of self-efficacy in pelvic floor muscle training as it demonstrates an individual's belief in their ability to control events through their own actions. The aims of this systematic review were to explore the facilitators and barriers in participation to pelvic floor muscle training, identify the key influences for self-efficacy which promote participation in pelvic floor muscle training. Qualitative exploration into experiences with pelvic floor muscle training has been considered in targeted populations such as postnatal women and those with stress urinary incontinence. This review was novel in that the consolidation of the qualitative literature includes all pelvic health conditions and populations, providing holistic examination of the attitudes and beliefs contributing to self-efficacy. It also identified which elements of the behavioural change wheel require closest consideration when addressing influences in participation in pelvic floor muscle training. To address the aims of this study, a systematic review and metasynthesis of the qualitative literature was performed using 7 databases. Qualitative literature was included in this review as qualitative research facilitates a deeper understanding of the emotions, attitudes, and experiences that may shape human behaviour. This is pertinent to pelvic floor muscle training as it has been reported that attitudes and beliefs towards pelvic floor muscle training may impact self-efficacy. The inclusion criteria is shown on this slide and incorporates experiences of patients, health professionals, and organisations offering pelvic floor muscle training. In this review, pelvic floor muscle training could be preventative or for symptomatic management. All qualitative data underwent independent line-by-line coding by 2 team members, and themes were agreed upon by the entire team. Thematic analysis was undertaken with guidance from the frameworks proposed by Attried Sterling and Brown and Clark. This involves a systematic approach consisting of familiarisation with the data, coding the material through dissection of the text, and identification of themes. Inductive analysis allowed for mapping of constructs within the key themes to be applied to the behavioural change wheel, otherwise known as the COM-B. The COM-B includes 3 factors that are required to facilitate behaviour change. These factors are capability, opportunity, and motivation. Application of findings to the COM-B allows for the identification of predictors of behaviour to allow targeted behavioural change. This prisma diagram reflects the flow of the study selection as a result from our search strategy. Our search identified 3,538 articles for screening and yielded 24 text studies that met the inclusion criteria. Thematic analysis identified 4 key themes that influenced participation in pelvic floor muscle training. These were interactions with health professionals, access to information and services, competing demands, and health professional skill and expertise. Each theme contains a number of constructs that contributed to the overarching theme, with interactions with health professionals containing the most number of constructs. Each construct has been considered with respect to the COM-B definitions for each factor of capability, opportunity, and motivation. This table demonstrates the constructs that fall under the 4 themes when applied to the COM-B. What can be seen is that opportunities for engagement in pelvic floor muscle training appear to be the biggest influencer, followed by capabilities. The following quotes illustrate the importance of opportunity and capability in pelvic floor muscle training. The quotes under opportunities demonstrate how competing social demands influence prioritisation and opportunities for participation. Technology was often reported as providing a platform of convenience and anonymity to access information relating to pelvic floor muscle training. Financial barriers often limited opportunities for health professionals to access literature, conferences, and professional development events. These quotes under capabilities reflect the need for specificity in teaching and information delivery to enhance understanding. Likewise, health professionals benefited from improving their own knowledge, skill base, and capability when they had access to experts and mentors in their clinical field. Through application of the COM-B, our results demonstrate that opportunities are crucial to enhancing self-efficacy in pelvic floor muscle training. Individual capability and opportunities to engage in pelvic floor muscle training can be created through positive interactions with health professionals that facilitate skill acquisition and understanding of the purpose and benefits of pelvic floor muscle training. Positive interactions can be influenced by a health professional's skill and expertise. Opportunities for health professionals to implement evidence-based practice and receive mentorship from experienced clinicians may facilitate this. Practical training that is financially and physically accessible will also promote clinician self-efficacy. Technology was considered mostly in the form of mobile applications and the internet. This was viewed positively to reduce embarrassment and provide autonomy whilst promoting convenience and accessibility. Opportunities for engagement and optimising individual capability are of vital importance when promoting self-efficacy in pelvic floor muscle training. Self-efficacy in pelvic floor muscle training can be promoted through facilitating understanding with multimodal information delivery best accomplished by positive interactions with health professionals. Technology was viewed positively in promoting autonomy and convenience through access to information. Thank you for your questions, and I welcome any comments and feedback in the chat function.